first of all, we're gonna start with topical. So what you're gonna need for topical is your cotton tip applicator, 2x2 gauze, and topical. And then what we're gonna do is we're gonna have the anesthetic set up for the reason that I'll show you how I get the topical ready at the same time. So patient scheduled, we're gonna go ahead and get our anesthetic all set up. So we have our needle shield. We have our aspirating syringe. You always wanna make sure to check, see how this is really loose. If this happens to come off when the doctor grabs it and is giving an injection, it could be bad. So always make sure that everything on the syringe is tight before you start. And then you have your cup filled anesthetic. So the first thing that you're gonna do is you're going to get your needle. You're going to twist off the back part of the needle guard, and then you're gonna place it in the syringe. How I do it is I use my finger as a fulcrum to hold it, and then you wanna make sure to get it on straight, okay? You don't want it hitting the sides because it will bend it. So you're gonna put it on. As soon as you get the needle on, you're going to put the needle guard on. So just get used to doing that so you never have to think about it, because you always want that on. Then what you're gonna do is you're going to take your carpule and you're gonna pull back on the syringe, which will pull the harpoon back on the inside. Pull back, put the carpule towards the back of the syringe so it's not hitting the needle, and then push it forward to engage in the needle. If you don't do it that way and you put the front in first, you're gonna bend the needle or have a better chance of bending it. And then once you get that in, you can release it, and then you're going to engage the needle just by tapping it on the back a couple times. If you tap it too many times, it's gonna shoot anesthetic out the end and you're gonna waste all the anesthetic. So just a couple little taps and it's engaged and you're ready to go. So then you can set that to the side. To get your topical ready, you'll open up your topical, take your cotton tip applicator. You don't need a lot. I usually just kind of spin it around and pull it out. And then you have your needle guard that you had on your needle, and you can just use that as a shield for the topical so it's not getting all over everything. And then you can just set it on a 2x2 gauze. So now you're ready for the patient to come back into the chair. Once they get back, you're going to have the patient sit down, go over health history, go over what you're doing, and then you're gonna start topical. With the topical, you're gonna take a 2x2 gauze and you're going to dry the area. And then you're going to take the cotton tip applicator, place it in the area desired, take another gauze and put it over it. That way it doesn't spread to the entire mouth and it can just sit in that isolated area. Once the 4 minutes is up, you can go ahead and take it out, and you can use that gauze if it's not too saturated with saliva to kind of smear off the excess topical. And then they're going to go ahead and give the injection. When you give the injection, you're going to take the cap off. When you pass it, you're going to pass it like this so that doctor can grab on to the needle and go straight into the mouth, okay? So you're gonna have your hand on the bottom part of it. When you pass it, doctor's gonna give the injection. You're gonna have the guard and the cap waiting for the doctor to go ahead and recap it. Macy had asked what to do if the doctor gives you the needle in surgery or something, or just hands it back to you. How do you grab it? So when you do it, it's not ideal. You don't want to, because it's a dirty needle. When I handed it to them, it was clean. So even if I get poked with it, it's still a clean needle. You would just take it apart, do it again, and you're good to go. No ill effects. Now that it's dirty, if I get poked by it, it's a big deal. So if you happen to have to take it back, then you're gonna grab it the same way. Usually when you grab an instrument, you're gonna grab with your pinky and pull it. Of course, you would not do that with a syringe. You're gonna grab it just how you did when you passed it so that you have complete control of the needle, all right? Even if somebody bumps me, whatever, nothing's gonna poke me if I'm holding it like this, all right? When you go to recap a needle, which again, it's not ideal, okay? So when you go to recap a needle, you're never going to have your hand anywhere near this. I don't care if it's wobbling all around, it takes you 10 minutes to recap it. do it. You're not ever going to take your hand and touch this guard while you're trying to put a needle in. It's sharp enough, it could actually penetrate through the shield, okay? Or through the guard. So you're going to take it, push it through till you get it all the way up, and then you can tip it up and tap it. Now it's on. Okay? So you never, I mean, I've seen people like try to go like this and do it. Don't do that, because if you miss it, it's gonna go through. So on the table, press it, and then tap till it's on. When you're gonna disassemble it, complete reverse. So you're gonna pull it back, disengage the harpoon from the carpule, pull it back, pull the carpule back so it's loose. It comes off and you can discard it. Once the needle is ready, you can go ahead and unscrew it by holding on to the guard. And then you're gonna take it over to the sharps container and push it through. Okay?